In this presentation, I will talk about the periodontal disease. Guys, before talking about the periodontal disease, we should know the normal to be able to distinguish the abnormal or the periodontal disease. So that as a simple review, the periodontium is consisted from four parts: the gingiva, the bone, the periodontal ligaments, and the cementum. And if we can see the periodontium from the outside, we will see the gingiva only. And that gingiva is characterized by the presence of the following things. The first thing is its coral pink color. The second thing is there is no swelling, but there is pitting in it mostly, and there is no bleeding. And if we see it from the inside, because the other parts of the periodontium, which are the cementum, the periodontal ligaments, and the bone, are embedded in the bone, so that we cannot see them by our normal eyes, but we will see them by our magical eyes, which are the radiographs. So that here we will see that that white line that surrounds the root of the tooth is the lamina dura of the bone that surrounds the tooth. It should be continuous, and that is the normal bone that surrounds the tooth. And the black line that is between the tooth and the white line of the bone is the periodontal ligament space, because they are ligaments, they are soft tissues, so that they cannot be seen by our magical eyes because they are embedded in the bone, and they cannot be seen by the magical eyes because they are not hard tissues. But their place, that black place or radiolucency, will indicate to them, and they should be not inflamed or diseased, and so that there should be no widening in their place, to know and decide that the periodontal ligaments are in the normal state and not in the disease state. Finally, the cementum. The cementum, also like the periodontal ligaments, cannot be seen by the normal eyes nor by the magical eyes, but we can see it here in the abnormal situations like the hypercementosis. As you can see here in the lower left lateral incisor apical area, that there is a hypercementosis, and this is the only condition that we can see cementum in it. Now we can see the normal from the outside and the inside. From the outside, which is the gingiva, that is composed from the free gingiva and the attached gingiva, and then the alveolar mucosa. These three structures are separated by the free gingival groove from above and the mucogingival junction from below. We have also the cementum, the periodontal ligaments, and the alveolar bone, and finally we have the gingival sulcus from above. The gingival sulcus is the most important thing that we will examine during our periodontal examinations to determine if there is a periodontal disease or not. Also, there is something called as a biological width. The biological width is the junctional epithelium plus the connective tissue attachment. And both of the junctional epithelium and the connective tissue attachment must be respected, and we should not impinge on them, because they act like the boron bars in Chernobyl reactor. If we respect them, they will control everything, and there will be no periodontal disease. So that after knowing the normal, which is the normal gingiva, the normal bone, the normal cementum, and the normal periodontium, now we will talk about the abnormal. And generally we have 7 diagnoses in periodontology. the first one that we have talked about. The second one is the gingival diseases. The third one is the periodontal diseases, or specifically the periodontitis, and the fourth one is the necrotizing ulcerative periodontal disease. The fifth one is the periodontal abscess. The sixth one is the periodontitis that is associated with an endodontic lesion. And finally, the developmental or acquired deformities and conditions. The gingival diseases are two, either inflammation or enlargement in the gingiva, or both of them, inflammation and enlargement. They are characterized by three things. The gingiva is not coral anymore, but it is red, and there is a swelling, and there is a tendency to bleeding, or there is a bleeding already. The gingival enlargement, on the other hand, is mostly hereditary, like this case, which is the hereditary gingival fibromatosis that is caused by the DNA, as we can see its picture on the left under the microscope. And in general, the types of the gingival diseases are two, either the dental plaque induced gingival diseases or the non-plaque induced gingival diseases or lesions. The dental plaque induced gingival diseases are the gingival diseases that are associated with the dental plaque, with or without contributing factors. If there is a contributing factor, that would be either a systemic factor like the endocrine changes during the puberty or the diabetes mellitus patients, or blood dyscrasias like the leukemia cases, or it is associated or modified by medications, or it is associated or modified by malnutrition. The non-plaque induced gingival lesions, on the other hand, are the gingival lesions that are caused without the need for the dental plaque and the associated factors to the dental plaque, which are either bacteria like the Neisseria gonorrhea bacteria, or viruses like the herpes viruses, or fungi like the Candida albicans fungi, or genetic origin like the hereditary gingival fibromatosis, or gingival manifestations of systemic conditions, for example, the autoimmune diseases like lichen planus, the allergic reactions to the dental restorative materials and other dental products, or the traumatic lesions to the gingiva, or the foreign body reactions. These are in general the types of the gingival diseases, both the dental plaque induced and the non-plaque induced types. The third periodontal disease is the periodontitis, and let's say that the periodontitis is the adult form of the gingivitis, because mostly the gingivitis will be continued and become periodontitis. Periodontitis is the destruction of the periodontium, and specifically the bone and PDL. And to determine that this is a periodontitis, there should be a clinically detectable junctional epithelium attachment loss, or as we call it as the clinical attachment loss, or CAL. And that clinical attachment loss will lead to an increased probing depth and, of course, to a true pocket formation. With or without gingival recession, guys, the periodontitis might happen without the presence of gingival recession, because as you can see here in this picture, that the upper left molars have no obvious gingival recession but have a severe periodontitis. Okay, the probing depth and the clinical attachment level that I have just mentioned are our basic diagnostic methods in periodontology. The probing depth is the general depth from the bottom of the pocket to the free gingival margin. On the other hand, the clinical attachment level is the distance from the bottom of the pocket to the fixed reference point, which is the cemento-enamel junction. Guys, here I want you to know that the clinical attachment level and the clinical attachment loss are two names for one thing, which is the green area. But when we describe a disease, we say it is a clinical attachment loss. But when we describe a diagnosis, we say how much clinical attachment level we have. Okay? The periodontitis, according to the history-taking procedure, are three types: chronic periodontitis, aggressive periodontitis, or periodontitis associated with a systemic disease. The chronic periodontitis mostly affects the older people with the presence of with the presence of a normal immunity and a local factor like the plaque, and external factors like smoking and stress, and does not progress rapidly. On the other hand, the aggressive periodontitis occurs mostly in the younger people with abnormal immunity and without the presence of local or external factors, but in the presence of systemic factors like the genes, making it progress rapidly. And the periodontitis associated with the systemic disease, for example, the blood diseases or immunity diseases that will lead to decreased immunity, and a periodontal disease and syndromes like Down syndrome. On the other hand, the types of periodontitis according to the clinical examination, we have the localized and generalized form according to the 30% involvement. If we have less than 30% of the size involved, it is localized. If more than 30% of the size involved, it is a generalized form of periodontitis. And also, according to the clinical attachment loss, if it is from 1 to 2 millimeters, it is a slight periodontitis. 3 to 4 millimeters, it is a moderate periodontitis, and 5 millimeters and more, it is described as a severe or advanced periodontitis. So that the types of periodontitis are either aggressive or chronic, localized or generalized, slight, moderate, or severe. The fourth diagnosis that we have in periodontology is the necrotizing ulcerative periodontal disease. This type of periodontal disease is very simple because from its name, we have a necrotizing tissue that will lead to a blunting of that tissue, and specifically the interdental papilla, that is called as or described as a punched out appearance, or blunting of the interdental papilla, or a crater forming of the interdental papilla. That is a pathognomonic and a characteristic feature for the necrotizing ulcerative periodontal disease that you should never forget, because it comes in the exams pretty much a lot, the blunting concept that is caused by the necrosis. Okay, the other thing that we take from the name of the disease is the ulcerative, so that there is ulcers, because the necrosis will lead to a blunting of the tissues and the necrosis of the epithelium, leading to a discontinuation of that epithelium, or as we also call it as an ulcer. Because of that necrosis, blunting, and ulcers, there will be, of course, a FETID, other or bad odor from the dead tissue. Besides the characteristic features of this disease, we have the 5 cardinal signs and symptoms of the inflammation, because of course guys, we have necrosis, we have dead tissue and ulcers, so there should be an inflammation, and that inflammation is characterized by the swelling and pain because of that, and bleeding and fever that is mostly associated with lymphadenopathy and malaise, and finally a malfunction or a difficulty in eating during this disease. The necrotizing ulcerative periodontal disease has 2 types, either the on the left picture, which is the necrotizing ulcerative gingivitis, that is characterized by all of what we have said just now, and on the right picture we have the necrotizing ulcerative periodontitis, that besides what we have said, it is characterized by the presence of a clinical attachment loss. Okay, and as we can see in these pictures, that the spirochetes are the principal bacteria that are responsible for this type of disease. The 5th diagnosis in periodontal is the periodontal abscess. And guys, the signs and symptoms of the periodontal abscess: it is an abscess, so that there is a separation, and the separation will lead to a swelling, and the swelling, if it is located apically, it will lead to a mobility of that tooth. Okay, and of course pain. Besides the swelling and pain, there is bleeding and fever and lymphadenopathy, which is the inflammation cardinal signs and symptoms: swelling, pain, bleeding, or redness, or inflammation, and fever or hotness. The types of the periodontal abscess is defined according to its tissue of origin into gingival abscess, periodontal abscess, and pericoronal abscess that mostly occur around the impacted wisdoms. The 6th type of the periodontal disease is the periodontitis, that is associated with an endodontic lesion. And according to the sequence of event, if the pulpal tissue dies first, we will have an endoperiolesion lesion. If the periodontal tissues die first, we will have a perioendo lesion. And if both the pulpal tissues and the periodontal tissues die together, we will have a true combined lesion. In any case of these 3 cases, we should treat the endo first before any definitive periodontal treatment that is carried out. As you can see here in this picture, it is characterized by the presence of a tract from the periodontium alongside the root to the apex. And finally, the 7th type of the periodontal diagnosis or diseases is the developmental or acquired deformities and conditions, which are 4 types: either localized tooth-related factors, or that will lead to a periodontal disease, or a mucogingival factors that surrounds a tooth, or in an edentulous ridge, or finally the occlusal trauma. In this picture we can see a tooth-related factor that led to a periodontal disease, which is a fractured tooth, and in this case the gum recession, that is a mucogingival defect surrounding a tooth, and in this case There is a mucogingival defect that surrounds or present in an edentulous ridge, and finally the occlusal trauma that is characterized by the presence of pain on biting or percussion with a periodontal space widening because it is an inflammation of the periodontium that is either primary or secondary. The primary types occurs or affects the healthy periodontium. On the other hand, the secondary occlusal traumas affects the already damaged periodontium. Finally, the description coral. Coral pink, do not forget it. This is the coral color as Dr. Carranza described it, and I think because he's from Argentina that has a long beaches with coral in it, so that he has described this the gingiva as a coral, as having a coral pink color in it. Look how beautiful they are. Anyways, thank you for constructing the world by listening to this presentation. Always try to know, always try to spread knowledge and construct the world. Be kind to others because life is not short but it is limited, and that is for the greatest benefit to the humankind.